Hey, welcome back, everybody. It's time once again to meet our community, the Hispanic business community here in Orange County, powered by the Orange County Hispanic Chamber of Commerce and Orange County's only community radio station, OC Talk Radio, with Mr. OC himself. But he didn't come dressed for the occasion. We've got blue on. We're in an orange mood today. It's Orange County here.
Yes, welcome again to our community podcast show, powered by the Orange County Hispanic Chamber of Commerce. I'm your host, John Gutierrez, Senior Vice President here at the Orange County Hispanic Chamber. And with us again is our returning guest, one of our community leaders, one of our members here that is doing a great event with us next week. We're going to talk about this great event. It's called Dia de los Abuelos. Again, save the date, September 5th. We're going to go into it. Beautiful, beautiful community event. And so with us today, we have Miriam Ramos. She's the CEO and founder of Mint Health Insurance Agency. She's an award-winning agency, leading agents to help make Medicare clear. And of course, she's leading our event that we're going to talk about next week, which is supported in collaboration with our OCHCC Health and Wellness Committee. And she's spearheading a day to honor and celebrate grandparents, Dia de los Abuelos, which is next week. Welcome, Miriam Ramos.
Thank you so much, John, and thank you to the OC Talk Radio.
There you
go.
go.
Happy to be here. Thank you, Paul.
Can I give a shout out? She two things I want to point out here. Last time she wore mint green, if I recall correctly.
That's right.
Because it was Mint is the name of her healthcare agency.
Yes.
Today she got the memo. She came in orange for Orange County.
Yes.
And John was giving her...
I was giving her a hard time because she's blending into
the background.
To OC Talk Radio's orange.
Our powerful orange background.
Yes, because of Orange County.
Right.
Which, by the way, I love this wall. I just love it. I love this color on this wall.
No, you don't.
Sure you do.
And I want to thank her because she brought us a gift. Nobody ever brings us a gift when they return. She
Miriam
brought us a cool bottle
Paul
of wine.
A nice bottle of, what is it, Wilson Creek?
White
wine?
Cabernet. I've never known of a white
Very
Cabernet.
unique.
Just so you know, my wife listens in. She's going to be a little hurt that, she didn't get no wine.
I'll take care of her.
Honey, she says, don't you worry. She's taking us to the winery.
That's
There.
true.
We're going to go
to brunch.
wine tasting.
Okay.
And to brunch.
Yes, and with that, we should take our parents with us. You know, a lot of these seniors in our community, actually, you know, we've talked about this, right? Like taking them on a bus, on a trip, right? I know a lot of the seniors go to the casino and they go to Pachanga, which is okay. They're retired. Yeah. They've earned it, right?
Absolutely.
I mean, it's their retirement. They can do whatever they want with their money, right, Miriam? But we're also going to talk about, of course, some key things happening for our seniors as far as health and benefits,
Medicare,
right?
especially.
Yes, Medicare and changes, right, Miriam? Why don't we get into some of that? Because you've been on the show before, and you know I know this is what you specialize in. But why don't you give us a brief rundown? What's happening with Medicare and what's going on?
Yes, well, thanks, John, once again for allowing us to use this platform to educate our community and bring them up to speed as far as the changes that are coming up. And if some of our listeners have been following up with those changes, we see something called the Inflation Reduction Act. This will definitely impact the cost of the prescriptions that Medicare eligibles will be paying for as of next year. So we do want to make sure we emphasize on bringing the awareness to the community, and especially to our Latinos, to our Hispanic community, Spanish speakers that often enough just dismiss those letters that they receive. They will all receive something called the annual notification of change by October 1st. And by this time, they will actually, if they take the time to read it, realize that a lot of the health plans that they have been so comfortably cruising on for the last 20 years may now have prescription drug deductibles. And this is definitely the year to shop. It's definitely the year where we encourage Medicare eligibles to come out to meetings with trusted health advisors, licensed agents, and learn about the changes, the benefits, and truly make the changes that they may need based on their prescriptions, which is what runs their bills the most. Prescriptions is something that they have to pay for every month. So even though their health plan may have lots of goodies and giveaways and such, if their prescriptions are not on the formulary or have high deductibles, how are they going to be able to have access to them?
So October 1st is a very important date
Absolutely.
that we want to get the word out. October 1st, they get a letter in the mail or they get some sort of notification.
And do they
Correct.
send it in multiple languages, or is it all just in English?
I am assuming they for
Probably
sure will send it in English, and there's also a letter that comes with it with different phone numbers for different languages that they should be able to reach out to and receive these types of information in their language.
Now, all I hear, as we're in a political season here, and we've had this crazy turnaround here where President Biden sent him running, and then he decided not to run after a poor debate performance. But one of the things he kept touting was, I put a limit on prescription drugs for seniors. You're saying no, that there is not a... Well, I'm confused what they keep talking about and what you're talking about.
And we mentioned we weren't going to get very political here.
No. But wasn't there some effort to cap prescription drugs for
And
seniors?
there has been, especially with insulin, right? We've seen that in the last 2 years. But this is, once again, something different, something new. And this is truly, if I start throwing out terms, some of our listeners may or may not be able to relate or understand.
Okay.
So that's why it's so important that the person comes out and actually learns about what these changes are about. So something known as the donut hole or the prescription drug coverage, right?
That's where you had to get Part B or C or something?
That's
what was it? Right.
related to Part D, which covers D as in drugs. So that's supposed to go away, right? But in return or in exchange is where we're now going to start seeing deductibles. So once again, there's a lot of new terminology that I do not want to confuse anybody about, and that we even ourselves are still evolving and learning about. We actually have a 2-day rollout coming up September 4th and 5th for my team, where we will have health plans come and deliver all of the latest on the information that we need to be prepared to share with our public, with our members, and with those shopping this annual election period, which will begin October 15th.
Okay.
It ends December 7th.
So I am a senior.
period.
That's why I'm butting and ask one more question. I'm over 65. My wife's over 65. John can't believe it, but yes, I'm there. And I know it's hard to
They
believe.
shouldn't be drinking wine. I should take that bottle. They're too old to drink
Too old
wine.
to drink.
I should take that bottle of wine with me.
We need it. So one of the confusing things when we got to Medicare was this idea. I thought Medicare is just a one size. You get Medicare from the government. I paid in all these years and I get this back, this health coverage. And then I discovered, well, that's just basic health coverage, which was up to, I forgot now, you tell me the numbers, like 80% or something of your
That
care.
is correct.
And then if you want full coverage, you've got to pay for the extra. Well, first of all, there is a price for this free Medicare. It's not totally free. You got to pay $174 a month or something like that to get this coverage. And then you have to decide, do you want the additional coverage, Part B, Part C, and Part D?
But that's
Tell
why,
us what those are.
But that's why they need to call.
Clearly. But just give us a
Miriam,
real quick,
right?
what's B, C, and D?
Because everybody's so different, isn't it? Like,
It could be. And then we add the factor of Medi-Cal, which is a state benefit, which
Right.
people sometimes confuse with Medicare, which is a federal benefit, right? So there's so many different terms out there. To your point, John, that's why these calls, right, where we actually speak with you one-on-one and identify your needs and where you're at and where we can help and bring additional resources to help you sometimes avoid paying those Part B premiums. But just to go back down, the ABCs of Medicare,
Right.
To your point, anybody turning 65 that worked for more than 10 years in the United States is a resident or a citizen, or at least has 40 quarters, has Medicare Part A automatically given at the age of 65. Part B is what you're talking about, Paul. That comes with the premium. Part A covers 80% of hospital needs. Part B covers 80% of medical needs. And then you talk about, well, what about C and D? Part C is your Medicare Advantage plan options. What is that? These are those private carriers that, I don't know if I can say a couple names.
Yeah, sure. Well, I mean, United Healthcare is a big one.
There you go. You said it, not me.
I have Blue Cross.
Hey, we're not giving any free promos to anybody.
I know.
Okay.
They got to pay. They got to pay. They got to pay to
But there's
play.
several big companies out there doing this.
There is. And so some of these carriers offer the Medicare Advantage plans that you can only access if you have Part A and Part B.
Right.
So Part C is technically putting all parts of Medicare together and adding additional benefits and subtracting such high expenses, right? It's truly one of the most beneficial ways to go.
And the other confusing thing was if you opt for an Advantage plan, it sounds great. There's no deductible or there's no cost for this thing. And they throw in all these extras. But you got to have a doctor that's in that plan that accepts that payment. So if you have some really specialized doctor, they might not take United Health or Blue Cross or any of these other things.
Actually, not quite really, because even carriers like the ones you just mentioned have different products in their portfolio. They have Medicare Advantage plans, which are known as Part C,
right,
and include prescription drug coverage. So you will have all four parts.
Right.
However, because they are a Medicare Advantage with prescription drug coverage, HMO, you are limited to the network, right, that you choose at the point of enrollment, which you can change on a monthly basis. You can change your medical group. But if you choose to go with more freedom, I always say freedom does have
a cost.
Exactly. Right. So what is that cost? Based on your zip code, based on your age, and based on sometimes health factors, right, that you may have to go through underwriting. Your premium can be very different, anywhere from, let's say, your Part B, if on average, about 174 and change.
Right.
If you decide to go with the Medicare supplement, depending once again on all those factors, it can range anywhere between 160 to, my goodness, we've seen very, very high premiums up to like $900, whether you believe it or not.
Wow.
And the worst part is, yes, you have the freedom to go to any provider that accepts Medicare throughout the whole country. So to your point, you can go to a specialist in Texas, right, to the best of the best in Kansas, etc. But you also have to purchase a prescription drug policy.
John's looking at the clock and, oh, this is way too detailed here.
Yeah,
it is. It's a lot of information.
I don't want to also overwhelm our listeners or our viewers because, we want to make sure that more than anything, I know Paul's trying to get a free consultation here.
I am.
On the podcast. But, this is why he's a perfect example of someone who's at that age range.
And confused.
This is important. And I didn't want to say it. You said it.
Yeah.
A bit confused, which can be confusing. We know this, right?
We're old, John. We get confused.
Hey, listen, I feel you, brother. I feel you. I'm going to be 50 and I can tell you, I feel the age, so I can imagine you at 90, it really,
That's what I am. I'm close to 90.
So I get it. And the whole point here, guys, is that, listen, I don't want to throw anybody under the bus. I don't know why the healthcare system does this. It almost seems like it's almost too confusing, right?
Yeah.
And therefore, imagine all those people out there that don't have a son or a daughter or somebody to say, hey, let me read this for you.
Right.
Maybe there's a language barrier, right? You don't speak English, a Spanish-speaking family. Obviously, with the Hispanic Chamber of Commerce, we have listeners that may have parents who only speak Spanish. My mom's a perfect example of that, right? She only speaks Spanish. And if I wasn't there to take care of her, or my sister who takes care of her, right, who would explain these things to her, right? And so there's a lot of elderly seniors out there that don't have these resources. And that is why Miriam is here today, to share an 800 number, right? What's the number?
The number that you all can call if you have any questions or would like a free consultation. You can call us at 1-888-225-6468.
That number again is?
1-888-225-6468. And we do have people that can take your call in English, Spanish, Arabic. And I'm proud to also share, John, that as of last year, we actually also provide American Sign Language interpreting services.
There you go.
Great.
And we do in-home consultations as well.
Yes.
So,
and the cost of these in-home consultations is?
Zero.
So,
absolutely.
So the only point I want to make, and then I'll get off it, is I was told my whole life, when you get to be 65, hooray, you don't have to pay for anything. Medicare kicks in.
Nothing's free.
Nothing's free. And
free,
it's
Paul.
confusing.
Don't ever
And there's
forget
lots
that.
of choices.
Especially when it's coming from the government.
Yeah.
Nothing's free.
So I was very confused and didn't know, and people are bombarding me with letters and things. I wish I'd known.
Well, and the
Miriam
other
at
thing
that
is,
time.
for our listeners and our viewers, just understand our healthcare system is constantly evolving and
Yes.
changing, whether it's good or bad. The point is, it's changing and evolving. Why? Because
Every year, John.
every year, because it's based on different factors, right? One is the elderly population, right? How fast the elderly population is booming, as we all know, right? And two is, of course, economic factors, right?
The cost of
right?
medical
The cost of
shooting up.
so for those of you that don't know this, you can Google it and find out that, and Miriam can point to this, that we've paid into Medicare. Let's say like Paul paid into Medicare all those years, right?
Yeah.
But the money his generation paid into Medicare,
It's gone.
And by paying, what we mean, and this is important, we explain this to people. By paying means that they automatically withdraw that out of your
Yes.
check every single time you're going to get a check
Right.
at your work. You don't look sometimes at all those things like taxes, and then there's a little thing that says there like withdraw. It's raked. Medicare. That money is being raked for your retirement when you turn 65. And so that is why when people turn 65, they say, you know what, I'm not going to retire till I'm 66 or 67 because they feel they might get a little bit more like retirement money and things like that.
Yeah.
But Medicare,
70s when it maxes
right?
out.
So his generation, Medicare, they were putting money into it. They're saying that money is running out, right? Which is a whole different topic in itself. So because that money is running out, what's happening is, because there's a lot of seniors right now, and a lot of them need these services.
12,000 turning 65 every
Every
day,
day.
in
Every
the
day.
United States.
12,000, right?
And we're not dying at 65 or 70 like they
They're
thought.
living longer. They're
Yeah.
living longer, right? Yes. I mean, Paul's a perfect example. He's going to turn 90.
I'm going to turn 90 soon.
Yeah, soon.
Yeah, hard to believe.
And look at him. He's running a podcast show. I mean, that's pretty
love
amazing. So, yeah. And it could be all this wine they're drinking. I
Could be.
heard it helps you live longer, you
That's
know?
it.
But to that point, just know there's resources like Miriam, right? Know that there's resources there to help you. And if it's not you and your parents, maybe it's a neighbor. A lot of times we know neighbors that need these resources and these services. And it's just a simple, like, here's a phone number you can call, and these people can help you, because not everybody has children that live with them. Like in my case, I take
And
care of
not
my
the
mom.
children may not understand it any more than the parents do.
Yes.
Exactly.
So just know that those are resources. And with that said, I want to get into our event next week, because it's an event that's going to provide a lot of resources. And this is a very, very unique event. We've never done an event like this at the Chamber that really focuses more on the seniors.
Yes.
In this case being Dia de los Abuelos. And you might not be able to see it because it's also orange, because like her orange jacket and
Perfectly.
the orange wall,
No,
everything's blending in. But you can go to, our website or our social media, OCHCC, and you're going to find that September 5th, which is next Thursday, depending on when you're watching this show, September 5th, 10 a.m. to 1 p.m. at the Delhi Center in Santa Ana, which is a great center, by the way. They're partners of our chamber. Miriam here, along with our chamber, we've collaborated and partnered together to bring you a great event for your parents or your grandparents, right? Basically seniors.
Yeah, absolutely. So the event is at no cost.
Free.
And we are welcoming any of you around the community to come and enjoy a day where
Yes,
we
Paul,
technically...
you can come.
I
You
can
and your
come?
wife can come,
Okay.
Paul. Yes.
You're invited. I'm sorry, your parents or your loved ones, anybody, past the age of 50, that RSVP.
So maybe even John could come. Oh, yeah.
Careful with the 50. I would say parents are 65 and older, right?
Well, there are grandparents that are in their 50s.
Really?
Absolutely.
Sure.
Wow.
So
Okay.
we just want to spoil them.
I thought we meant elderly, like elderly.
Oh my God.
You're calling me old now.
Yeah.
Come on now.
No.
Welcome to the club.
No.
Look at Paul.
We call it 50 and better or 50 and golden.
Wow.
So what's going to be really cool about this event is that Miriam did a fabulous job going into the Delhi Center and actually providing their seniors there like a little survey. It's really cool. And asking them what is it that they would like to see, or what is it that they would like to enjoy, right?
Yeah.
And you got some great feedback. Can you share about that?
Yes, absolutely. So I think when it comes to aging gracefully, you start seeing the beauty of simplicity. And amongst the answers that we collected, both in English and Spanish from some of the members of the Delhi Center, were simple things like a muñeca, a doll, something they never had growing up. Some of them asked for things like shoes or maybe a game that they can play with their grandchildren. They long for care, for love, for connecting. A lot of our seniors in the community, unfortunately, are, in lonesomeness, right? So bringing this event where every vendor, every sponsor, everybody there has definitely one requirement, and that is to give your best smile to every single senior that walks in there. Make them feel loved, make them feel appreciated, honor them for everything they've done for us because they've paved the way for where we're at today. So that's the essence of Dia de los Abuelos. It's about giving back. It's about having fun. It's about also bringing resources to them. And of course, bring awareness because it is important. Once again, it's our community. But it's about just, like you said, those simple things they're asking for. Goodness, a haircut can mean the world to a senior.
And I think also the thing that was really cool when we went there to speak to them.
A bottle of wine can mean
We're not promoting alcohol. We're not promoting alcohol.
Look at Paul. One of the things that was really cool when we went to speak to them was some of the people just said, we want to just dance.
They do. They do.
And that says a lot about, you're never too old to have that spirit and that soul of, I just want to dance. And it may not be like when we were young and you could dance like the young days, but still they want to enjoy that moment. And I know we're bringing mariachi.
We are.
Right?
Yes.
Mariachi Divas?
Mariachi Divas will be in the house.
Grammy nominated Mariachi Divas will be in the house.
Thank you,
John. They're good friends of ours. Cindy Shea was here on our show. Remember, Paul? Cindy Shea with Mariachi Divas. So they're going to be there.
Only Irish diva I've ever met. Irish mariachi diva.
Yes. So she'll be there, or their team will be there. And then the other thing is we're going to be making some of the special food that a lot of these seniors in our Hispanic community really it took them back home in their childhood. And things like tamales, birria.
Conchitas. Sponsored by our great friends at Loaded Cafe.
Yes, Loaded Cafe has stepped up. And they're going to bring in 200 conchas. And so, to all those community partners, I know, we have a lot at the chamber. Our friend Shelly Padilla is going to be sponsoring and helping us out.
Thank you, Shelly.
That's right.
She helped us with the free haircuts as well. There will be free haircuts at this event. It was part of the list. So thank you so much.
Well, and thanks to Mint and Miriam and her husband and this, fabulous business they have, because they were the ones that thought about this event and they brought it to us and said, what do you think about doing something like this? And I was like, wow, this is really cool. Because as you all know, we always do business to business events and we do some community events with other partners of ours. But I think what's unique about this event is that we're really focusing on the senior population. And I really love the name Dia de los Abuelos. I feel like this is going to be a huge event years to come, to be honest.
Indeed.
I was afraid, I don't speak Spanish. So when I saw Dia de los, I'm thinking of Day of the Dead. And I thought, oh, that's what they're naming it. The seniors are Day of the Dead. No, this is not that. This is
Paul, please. Paul, that's not till like November. That's Dia de los, in fact, we do.
Let's not confuse anyone.
Yes, let's not confuse anybody.
No, this is Dia de los Abuelos, and it's coming up September 5th.
Yeah.
It'll be at the Delhi Center in Santa Ana.
It's in the daytime, guys. In the daytime.
And is that a
10 a.m. to 1 p.m.
senior center like many communities have, or is this a live-in?
It's a community center, but they do.
Do people live there, or are they just walk-in senior center?
No, this is just like
a community center.
Just a community center. People go in to get resources, and they do a fabulous job of helping the low-income community there with food and other resources and healthcare. And so this event's going to have a lot of fun. This is about.
We're gonna have Zumba with mariachi. Like, have you ever heard of such thing?
No.
I mean,
Zumba
we're super
mariachi.
excited.
Yeah.
And the whole point is to make them feel celebrated.
Absolutely.
To make them feel, honored.
We don't honor grandparents, seniors, like other societies.
And to be honest, that day we want to thank them for all they have done for us. and the community and our
So
children.
if I show up as a senior, you're going to thank me, John?
Yes, sir.
Absolutely. And
For
you're
my
going to get
service?
tons
Yes,
of
sir.
hugs.
Oh, wow.
This is an event, honestly, guys, that I'm very, very excited about. I know we do a lot of events, but like I'll be honest, I'm bringing my mom, and my wife's bringing her mom and my mother-in-law, and
It's such an honor.
and a lot of our friends are bringing their moms, and we're telling our friends, bring your moms, because the other thing is this, guys. This is what I think is interesting. I can't really say that there's been moments where my mom has met maybe some of our other chamber members' moms. That's never happened.
Yeah, right.
Right?
Wow.
We all know each other. We all network, but our moms have never met each other. So it'd be interesting for them to sit, hopefully, and meet and talk about their children, right?
Yeah, and how
what
proud
do.
they are. Exactly.
Right?
Absolutely.
And I think that's really cool that our parents get to meet and quote unquote collaborate and network like we do on a
be
regular
part of
basis,
it.
right?
I hope people listening will find that senior in their family or their network or their neighborhood that nobody's talked to them in a long time.
But
you don't know how many seniors
you
are
do
alone.
have to reserve
We do.
that you're coming, because we can't just have thousands of people show up at the door and us not be prepared. So if you want to attend with your parent,
or a senior.
well, yes, a senior, and hopefully your parent is a senior.
Yeah, but I'm saying maybe there's a neighbor
Yeah.
or a cousin or
Yeah.
somebody else.
Yeah.
But just keep in mind, we also want to make sure you bring people that you know. I don't want to just have people there we don't know, and then it gets kind of chaotic. We want to make sure this is an event people are enjoying, right? And they're having a good time, and it's somebody you know that you feel is special in your life, and it could be your neighbor, could be one of your mentors, somebody you grew up that just was a nice mentor to you. And then RSVP by calling again this number.
Yes, please make sure you call an RSVP by calling 1-888-225-6468. There's just a couple of things that we will ask from you.
Yes.
It is, of course, your name, so we can go ahead and add you to that registration
To the
link.
guest list, yes.
I'm sorry, to the guest list.
Yes.
Your phone number, so you can get a reminder text the day before. We
Yes.
really don't want you to miss out on it. And if you're bringing a guest, right, we just want to make sure that we have enough of everything.
Trying to have enough food and
Exactly.
resources for the event and the community. It is from 10 to 1, and please don't be on Hispanic time. Like, don't show
No.
up.
Is
Don't
there a
show up
Hispanic time? Okay.
Don't show up at 2:00 and be like, "I'm here," and then you're walking in with your mom or dad, and then we feel bad that there's no more
Because there's
food.
no one else.
There's no more food, and it's kind of the day. The event has ended, and now we feel bad that you. So don't do that, please. Don't do that to yourself. Don't do that to your parents. Don't do that to us. Please arrive as early as possible. Bring them. Enjoy the event. Again, I think it's going to be a fabulous, beautiful event, because for the first time, our parents going to get to meet each other and hang out and network and talk, and we hope they talk. I don't know how shy our parents are going to be. I don't know. Our
I don't
grandparents,
know.
right? So
But when you involve music and you
Yeah.
put them in a place where they feel loved and they feel like you're connecting them back to their roots, to their, childhood and such, I think it's going to be just magical. It's going to be wonderful. And I want to remind everyone there will be raffles.
Oh, that's right.
And
Prizes.
Prizes
I
at
forgot
the
about that.
door.
Yes.
The first 50, which we have already exceeded the 50, are receiving special swag bags with some cool.
swag bags.
Yeah. I mean,
This
we're
is
gonna
like a
call-
Hollywood party.
It's going to be fun. It's going to be a blast. And we
Yeah.
couldn't be happier to be able to make it a reality. And I want to thank you, John, and the Chamber and the Health and Wellness Committee for
Yes.
believing in the vision. And I will not let you guys down.
No,
My goal
no,
is
no.
to execute the most amazing day for our abuelitos.
Yes.
And this is all inspired by that woman who is my abuelita, who is no longer on earth with us.
yes.
But I know that she's with me every day.
That's
She
right.
actually sits on my shoulder. I always say that.
Oh.
And
What was her name?
her name, well, we always call her Nena, but her name was Elena.
Elena. Oh, that's my mother-in-law's name. Elena, yeah.
Elena.
And with that, I want to also give a shout out to my wife, because her and my mom and my sister are going to be there on behalf of our OC Hospice, which many of you know we own a healthcare company, and they're going to be making food for the event. We're going to be making a big pot of birria, which is beef, kind of like stew, and this delicious sauce. Many of you who follow me know what birria is, right? It's a very popular,
Thank you,
famous
guys.
food that we do in our culture, right? Every quinceañera, every boda almost has birria all the time, but it's something that takes us back to our roots. My dad used to love making it when we were growing up as kids, and my mom makes it now once in a while. And so,
what a treat! We get to taste your mom's
recipe,
food,
or it's either going to be my mom's recipe or my mother-in-law's, because either one makes it. But I want to thank my wife, because she's the one that's going to help put it all together with them, and they're going to be there that day to help out. And so I'm excited to be able to share a little bit of our family, a little bit of our family recipe with our community. And not only that, but, we're looking to have tamales and other stuff, right? I mean, so the conchas.
Yeah, absolutely.
We kept debating on the whole alcohol thing. We thought about having like, I don't know, in Mexican communities for
Ponche.
Christmas, you have ponche, which is very popular, which is an organic, drink, but it does have a little bit of alcohol. And so we're
skipping on that this time, guys.
We're skipping maybe next year, we can do that if it's like a night event or something. But again, September 5th, 10 a.m. to 1 p.m. at the Delhi Center in Santa Ana.
And reservations?
And just so you know, the Delhi Center is 505 East Central Avenue in Santa Ana. Okay? Again, that's 505 East Central Avenue in Santa Ana, the Delhi Center. And it's basically the main cross streets are Warner and kind of like Main Street over there, between Standard and Main on Warner.
How do you spell Delhi Center?
Delhi. Delhi Center. And again, please RSVP, because we want to make sure we have hopefully enough. Yeah.
Yes, definitely.
Okay, and the reservation number we'll go out on that is 1-888 something.
Go ahead.
It is 1-888-225-6468.
Again, 1-888-225-6468.
Operators standing by.
Ready to take your call.
All right, folks. Thank you for tuning in. Miriam, thank you for doing this.
Thank you all for believing in it.
We're so excited. We'll put it all on social media. So definitely follow our OCHCC.
Don't miss out.
Yes, don't miss out. Great opportunity. Bring your parents and leave a comment. If you're on social media, leave a comment if you have any questions. And if you want to help out.
Exactly.
Anything you want to donate.
Thank you. Please,
be a part
by
of,
all means.
Or you want to sponsor something, let us know. Get involved with what we're doing. We're open to more ideas.
Absolutely. That's exactly what I was going to add. Thank you, John. You're the best.
Thank you, Marianne.
Thank you, Paul. Thank you, OC
Paul.
Talk Radio.
Paul, I'm taking that bottle of wine, Paul.
Over my dead body here. Well, there you have it. One more reason to tune in each and every time to meet our community, the Hispanic business community here in Orange County, powered by the Orange County Hispanic Chamber of Commerce, streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center.